welcome back. Well, we have a couple gentlemen on. In fact, they're orthopedic surgeons from the Hoag Orthopedic Institute that is in Irvine, and that's what I just found out. Wasn't sure where it's at. So it's right over here at the Hoag facility off of Sand Canyon. And I'd like to welcome Zachary Alder here today. Nice to meet you, sir.
Nice to meet you.
And Corey Lieber, nice to meet you.
Thanks for having us.
So first of all, we're going to talk about different kinds of things here. But in basic, what's a fracture? And who wants to talk about that first? Because we think of a broken leg or something like that, but
yeah.
In general, what is it?
So a fracture is medical terminology to mean a broken bone.
Mm-hmm.
So the two terms are interchangeable. It just depends on if you're using medical terminology or layman's terminology.
Okay.
A lot of people have that question, but the simple answer is they're the same.
Okay.
And fractures can occur in any bone in the body. Most commonly, we see them in certain locations of the bone, particularly the hip, the spine, the shoulder,
mm-hmm.
and the wrist. But they really can occur in any bone in the body.
Okay. And Dr. Alder, what about, we hear of compound fractures. What is the difference between the two? I imagine one is a little bit more advanced than the other, right?
So compound fracture is a term that we typically don't use as much anymore, but by definition that means that it's the type of fracture where the bone actually breaks through the skin. So it's any sort of fracture with any associated cut
mm-hmm.
Or abrasion or laceration over the skin at the area of the bone. We now refer to them as open fractures. Fortunately, they are much less common than regular fractures mm-hmm. because they do tend to be a little bit more difficult to take care of.
Okay. Now, I guess in general, to prevent fractures, you basically kind of take care of yourself. Obviously, if you're out doing any kind of activity, from sports to riding a bike, anything like that, there's always that possibility that something happens and you can break a wrist or break an ankle or something like that, right?
Yeah, fractures occur in people of all ages, mm-hmm. and the mechanism of how the fracture occurs really depends on the patient, what they're doing, and what their bone quality
mm-hmm.
is. And so in younger patients, we see fractures occur from generally higher energy mechanisms.
Mm-hmm.
In kids, usually falls off jungle gyms or sporting events. And then as patients age and their bone quality isn't as good and they potentially get osteoporosis, the mechanism and the energy required to break a bone becomes a lot less. And so fractures occur with just simple falls from standing, falling out of a bed,
mm-hmm.
Tripping over a curb.
Yeah, and that's a very good point. We've heard this many times before. Just simple changes to your house can at least help prevent fractures, and that can be as simple as area rugs where they're placed. And I know many years ago, my mom ended up breaking a hip because she liked where the dog's water dish was, and the dog drinks water, it spills a little bit, and she slipped, and there it was. So there are many different ways to just simplify things. It doesn't mean it's going to prevent it 100%, but there's certain things you can do.
And I would also add that we tend to see most of these sorts of fractures in the elderly community tend to occur at night. A lot of times when people are getting out of bed to mm-hmm. either get some water or go to their kitchen or go to the bathroom. Mm-hmm. So another way to simplify that is to a lot of times consider some sort of low lighting, especially mm-hmm. around the floor, to try to see things like the dog dish or a carpet or a shoe that you forgot to put away. But that can also help prevent those types of injuries. Yeah,
and that's, again, very easy, very inexpensive mm-hmm. To do for sure. Now, what is the connection between fractures and osteoporosis?
Well, like I briefly mentioned, osteoporosis is a disease that affects a lot of people as they get into their older ages. And osteoporosis leads to brittle bones or more fragile bones. When a material like bone becomes more brittle, you can think of it as the material changing to one that's less flexible and mm-hmm. more easy to break, such like a glass.
Okay.
And so when you develop some form of brittle bone disease or osteoporosis, again, it takes a lot less energy to break your bone. And so when you talk about patients that come through the emergency room with a broken bone that are over 65 to 70 years old, most of those fractures have some correlation with the underlying problem with the mechanical stability and strength of the bone, which is osteoporosis.
Okay, as far as osteoporosis goes, is it inevitable that we'll all get some form of it? I certainly know over the years that I've heard many different things can heighten the possibility of that. The smoking is a very good example. But is it something that we will all suffer from to at least some degree?
Not necessarily. I mean, there's
Okay.
so many factors that play an influence in terms of whether or not you get osteoporosis
Okay.
at all versus the extent of your osteoporosis. Genetics, unfortunately, tend to play a very large role in that, so there are some things that you cannot control. But there's lots of things you can do to, if you are unfortunately one of those people who tends to have a genetic predisposition for osteoporosis, there's a lot of things you can do to decrease the extent of the fragility of your bones. Things
Okay.
like exercise, appropriate diet, that sort of thing.
Okay, and does extra calcium in your diet that we've always heard help, does it?
Yeah, so there's a recommended daily allowance of calcium and vitamin D that everyone is recommended to have. All of our patients with fractures, if they are not already taking it, get supplements of calcium and vitamin D as at least a first stage treatment to try and prevent further fractures. But clearly, if you were to take it a step further, prevention of the first fracture should involve supplementing with calcium and vitamin D.
What about when that fracture happens? With somebody with osteoporosis compared to someone who does not have that, the healing time involved, and do you doctors have to change the way, your approach anyway, to mending that fracture?
Yes, there is a very real difference between a fracture that occurs in a younger person who has healthy bones versus somebody who has osteoporosis or brittle bones. And the way in which we manage that tends to be very specific to the bone that's broken, as well as to the associated osteoporosis in that bone. So there are a lot of specific things that we'll do, which sometimes include surgical intervention, sometimes they do not. I mean, if at all possible, we try to get people back to their previous level of activity without doing anything like an invasive surgery. But unfortunately, a lot of times we're unable to do that successfully.
Okay. How common is the hip fracture above anything else when you get to that certain age and you have osteoporosis? That seems to be the one you hear about most often.
Well, the hip fractures you hear about the most often usually because they come with it a lot more inpatient hospital care and longer rehabilitation. In that osteoporotic fractures fall into one of about 4 common categories: hip fractures, wrist fractures, fractures around the shoulder, and spine fractures, such as compression fractures. Of all of those, the hip fractures are the ones that really cause patients to be the most debilitated in that they can't walk and they can't get out of bed. And so those type of fractures are the type of fractures that patients usually have to call the ambulance and get transported to the emergency room and get admitted for some sort of surgery to stabilize the hip.
Okay. We talked about preventions around the home. What about just in general? Somebody's out, in the supermarket or on the mall, and as far as taking care of themselves, if they have osteoporosis and they have gone in and that's certainly been found to a certain point, should they at least be carrying, having a cane with them or a walker or something like that, just in case they feel that they might fall?
Yes, especially if they've had a history of falls in the past. So one of the things that we know is once you have your first fall or you sustain your first fracture associated with osteoporosis, the likelihood that you'll have another fall or sustain another fracture goes up dramatically. So we encourage all of our patients that we see with any sort of fracture to at least consider using some sort of cane or walker or something, especially when they're out of the house in an unfamiliar environment where the risk of falling or stepping off a curb is of course higher.
All right, good information, and it's great to have you doctors on and talk about this. Really, I think the message that I'm getting here is, when someone goes in for their annual checkup or whatever it might be, tell your doctor if there's a history of this in your family, and I imagined there's certain tests that they can do to at least pinpoint that. And if you see you're on the way there of possibly getting that, there are things that you can do to maybe slow that a little bit, right?
Yes.
Yeah, very good. Nice to have you here once again. Hoag Orthopedic Institute, it's right over here in Irvine off Sand Canyon. Let me give you the number for this particular, for the Orthopedic Institute. It's 855-999-HOI1 or 4641, as you can see right there. Orthopedichospital.com. Thank you very much for coming on. Great information. Nice to meet you, gentlemen.
Thank
Thanks
you.
for
All
having
right,
us.
we'll be right back.